parents like sitting in my office saying, I know this is a dumb question. And every time they say that, I think, oh, it probably isn't. This is probably like the most important question that you need to ask right now. I think it's okay to remind parents that even though they're subject matter experts in whatever their day job is, like assuming the job of a parent is something that nobody's going to expect you to be really like perfect at it.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Hi, everyone. Welcome, welcome, welcome. Welcome to another episode of the Care Room with Dr. Cindy. Today, I have another very special guest with me, Dr. Kirin Palmer. She is a pediatrician joining us today. She's a mom and she is going to share her wisdom. I can't wait for you to hear all what she has to say because I need some of it too. As a busy mom, hello. Hi.
Right.
But before we get into everything, I'm just going to let Dr. Palmer introduce herself.
Yeah. Thank you, Dr. Cindy. No, as you were talking, I was like, oh, I want to hear what wisdom I have to say too. As Dr. Cindy mentioned, I'm Dr. Kirin Palmer. I'm a general pediatrician. I have a private practice here in Portland, Oregon, where I take care of newborns all the way up to age 21, and I'm having a great time doing it. I also am a mom, and I have the privilege of really kind of walking alongside a lot of families, a lot of moms, and I get to see their struggles, hear their stories, and be a part of sometimes like decoding the one thing that maybe makes a difference, or sometimes just like kind of going through the struggles with them. And so, yeah, so I've got my own story as a mom, and I've heard so many stories of other moms out there that, are struggling with the challenges.
Sure,
So, yeah, thanks for
sure.
having me.
Absolutely. Absolutely. So, can you tell us more about your journey as a mom? Like, what did you become a mom? Did you always want to become a mom? Was being a pediatrician part of that?
That's such a great question. So, I am the oldest of eight. My parents were divorced when I was about 11. They both remarried and had new families, and I was the oldest. I was the king of the hill. But, anybody out there that's like the oldest child, that a lot of responsibility. There you go. Good things happen to the oldest child. It's okay, but anybody else that's out there who's the oldest child, like, a lot of responsibility actually falls on your shoulders, sometimes at a younger age. And I think if you have parents who are divorced, sometimes that happens even sooner. And so I had seven brothers and sisters, and one of my siblings has a medical condition, and I was often like watching over him when he was sick, and he has a seizure condition, and so when he was sick, that would sometimes provoke seizures. So there I am. I'm like 15 or 16. I can't even believe that my parents did this, but like there I am, like watching over my brother while my mom's at work, and he's like literally seizing in my arms.
Yeah.
And I think a lot of adults, even parents of children who have seizure disorders, like if you've ever been through something like that, it's very hard because the person that you're watching over that's having a seizure is not quite themselves. And I think, I changed a lot of diapers back in the day. They were cloth diapers.
I can imagine.
Right. Went to a lot of doctor's visits. As the oldest, I also was the one that was usually watching over them if they were swimming in the pool or in the beach. And I have fished out many of my brothers and sisters out of the water, which is one of the reasons that I'm so driven to teach the families I take care of about water safety and really like watching over their children like a hawk. I don't mean to add like extra anxiety for parents. All the contrary, as a pediatrician, like a lot of times I see my role as helping parents understand what they're seeing or helping them anticipate what's to come so
Right.
that they're less anxious about what they're seeing, or they're less anxious when something happens. And they're like,
Sure.
oh, I expected that because Dr. Palmer said that was going to happen. But water safety is a huge thing. So I think that that combined, we are sort of the composite of all of our experience, right? And we bring that into medicine. We bring that into relationships that we have. We bring that in as like a neighbor. And so I think that that all kind of helped me understand that I actually was very comfortable around children, had a really good sense of like childhood development. And I think if I were somebody else, it might have done just the opposite. Like it would have scared me from ever having children of my own, never go into pediatrics. But for me, at least, it was like kind of a trying ground, a proving ground. And so when I went into medicine, there are no other physicians in my family. Um, yeah, nobody. And when I went into medicine, I had a pretty good sense that I was going to be a pediatrician. And I thought I'm going to keep an open mind.
Right.
The transplant surgical team at Hahnemann University in Philadelphia wanted me to go into surgery. I'm so glad that I did it, but I have the most respect for people who have surgical hands
Absolutely.
and minds. They are the mechanics of the body, and we need them.
Absolutely.
Not to discourage anybody out there that wants to go into surgery. And then I also looked at med peds because I really like octogenarians. I love hearing their stories. I
Yeah.
love learning their wisdom. And just like, I don't know, it's like having a glass of vintage wine. You're like, "Oh my
Ooh.
goodness,
Yeah.
this is
They,
so good,"
they
right?
are very wise. They are. I like,
Yeah.
the
Yeah.
life lessons.
Right?
Yeah.
Yeah.
Absolutely.
And then occasionally they'd show up to the appointment and I'd be like, "What medication on?" And they like bring out the big gallon bags like this. I'm like, "Surely you're not on all that." They're like, "Oh no, this is expired." I'm like, "No, no, not the medication you're supposed to be on, the medication you're currently taking." So I looked at that and I realized that I thought at the time, if I did like this medical pediatric, like internal medicine and pediatric fellowship or residency, that I would be limited to working in a hospital. And I really wanted to keep my options open. So interestingly enough, I did a pediatric residency after studying in cold Philadelphia. I know the moment it happened, I was scraping ice off the windshield, and I'm originally from Hawaii. So here I am in Philadelphia, scraping ice off the windshield. And I was like, we will not be doing this in residency. We are going someplace warm. We are not going to be digging our car out with a shovel at the end of a shift. And so I went to Miami, of course, for residency and had a really fantastic pediatric residency training. And, I always thought that I would be a mother of four. But that didn't happen. I didn't get started having children. And I would say one child until I was 39. I delivered my son at 39, and it was so cute because my OB was like, "You should have more children. You have babies so easily." And I was like, "Oh, if only you knew." Everybody's birth story is different. Everybody's pregnancy is different. And I mean, happily for me, like pregnancy was pretty straightforward, and so was the delivery. But sometimes, like the context where we're having children, quite oftentimes it's not like what we thought it was going to be, right?
Right.
It's life throws us curveballs.
A lot.
Yes. So now at this age, and I remember like even before I had him, like when I was in my 30s, my first boss as a physician, I was working in a pediatric emergency room in Florida. And he says, "Boy," he goes, "if I knew at 30 what I know at 50." And I was looking at him, I was like, "Man, could you download some of that for me? I'd like to know that now."
Oh,
No, 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 no. I worked there for like a year and a half and I was like,
okay.
pediatric emergency medicine is not for me. Like
Mm,
this is not I do not find my mojo in the pediatric emergency room. But, it's helped my skills as a pediatrician. Like I am very comfortable saying, "I see what's going on and this is an emergency room visit or I can handle this." And then yeah, and so then I actually had looked at pediatric fellowship in nephrology and actually secured a position as a pediatric nephrologist at Texas Children's. Yes, and then I met my husband at the time and then decided to stay in Miami and give up my fellowship position. So, and that turned out to be a really great decision because I
okay.
have an amazing 13-year-old out of it. And I'm really good at all things, kidney and nephrology and
Right.
all of that. And I actually don't regret it because as one of my chief residents in residency said, she says, people forget this, but general pediatrics is a specialty, right?
Yeah.
We specialize in small, babies,
Yeah.
infants, small
We
children,
do.
and adolescents. And oftentimes, like people who aren't pediatricians or family practice aren't comfortable handling pediatric patients. They just like they either usually they overdo it and sometimes they underdo it, right? Like I see all sorts of kids coming out of urgent cares, and they're not splinted and they're fractured. So I am,
Absolutely.
yeah. So this is the place for me. I love general peds.
And thank you for doing it. I know when, because I'm family practice, when we train, we do pediatric rotations. And one of the things I think, as a med student, I was told, or what like when you're trying to pick what field you want to go into, when it comes to peds, is either you can see kids suffering and you want to help them, or you can not be able to handle that. And I think there are genuinely kind and caring souls like yourself who are able to jump in, when a kid is sick, and get them better and do it, and, have that attitude. And we are so grateful for you guys. Absolutely. And the little bodies and those in the NICU, kudos to you guys. Thank you, thank you,
Yeah.
thank you. Thank you for doing it. Because there are some of us like myself, I see kids
Right.
older, but
Yeah. Yeah.
so grateful for you guys
You
as
know, and
physicians and specialty.
I think that's where we get to this, right? Is that like everybody's an expert in something.
Exact.
And, oftentimes I find that parents, I see this all the time. Parents come in and they may be subject matter experts in something else, right? Like they're like engineers, they're like, very highly achieving grown-ups. And then they become parents and they feel like they're just like all thumbs. And I often times will have parents like sitting in my office saying, I know this is a dumb question. And every time they say that, I think, oh, it probably isn't. This is probably like the most important question that you need to ask right now. And so I think it's okay to remind parents that even though they're subject matter experts in whatever their day job is, like assuming the job of a parent is something that nobody's going to expect you to be really like perfect at it. And even those of us that have embarked on the journey as parents, like we're still not experts because guess what? Every child is different. And as we go through this continuum of their lives, like even though this child was the baby that you birthed or adopted or what have you, like as they go through their childhood, their needs, their developmental needs, what you say to them, like kind of change. So like our skill set as parents is I feel is like never really set and done because just as you've mastered this, like now they're drinking out of a straw, now they're climbing the furniture, now they're driving a car, now they're getting married, right? Like our skill set as parents constantly has to evolve and change. And so
I think, yeah.
I'm not the expert at my child's, 100% of the time. Like sometimes I get it wrong and I see parents do that too. And I think that's just part of the process. I think being a parent helps us. I think being a parent makes some of the most wonderful humans in the world because we learn to live with a little bit of sacrifice, like a little bit of self sacrifice. Sometimes we do too much of that. And right. And then we also learn how to be really flexible.
Yeah.
And it starts with like your birth plan. It never goes the way you thought it was going to go.
Yeah.
So, yeah. So,
Yeah.
welcome to parenting.
I
Yeah.
know. And thank you for that. Thank you for that reassurance. I know there are a lot of moms listening. So that brings me to my next question, Dr. Palmer. I know as a pediatrician, you see a lot of parents come through. How do you, or what would you recommend to the mom who's burnt out?
Mm,
She's juggling everything, right? She's
yeah.
working, she's trying to make an income. She's trying to balance like after school activities, whether it's soccer, basketball, swimming, all of that.
Hmm.
She's trying to find time for herself, to take care of herself, go to her own appointments, do the things that matter to her. What
Hmm.
would you say to that mom as a mom
Yeah.
and a pediatrician?
Well, as you asked this question, I was like, oh, yeah, that's me. What would I tell myself? Right. And I would say, just like, even kind of approaching it from like a higher level, I would say, if in your life as a woman and as a mother, if you have not had a challenge in your life, like one of life's curveballs, now is the time to really start to develop a system where when those happen, you're okay. You're okay-ish. You're not maybe 100% great, but it doesn't like, throw you over. So I would say the first thing is like taking a step in the direction of actually making sure that you're okay. I think I had this. I mean, I've been a mom for almost 14 years now, and I still get nervous when school starts. I get nervous because whatever his schedule is, it affects my schedule. And until we've done like the first couple days of school, neither he or I are like into a routine. And so I think, we try to establish routines for our kids and don't realize that those routines also become our routines. And, there's some wiggle room, like there's some things that we can do as parents to try to kind of direct the routine a little bit. But then there's the things that they need to do or that they want to do that we then have to figure out, well, how do I accommodate that in my schedule as well? And so I caught myself at the beginning of this school year. And I think this is, for me, it was a realization of how far I've come. And that was that it was like the first day of school. And in my head, I just was starting to feel very overwhelmed about all the new things that were going to happen on that first day of
Sure,
school.
sure.
And also manage like getting myself to work on time and seeing a full day's worth of patients. And I was like, I have a routine of doing some sort of movement every morning. Sometimes it's weightlifting and sometimes it's just yoga and sometimes it's just walking the dog. And I was like, I don't have time for this. I don't have time for this today. I have to make a lunch. I have to make a breakfast. I
Right,
have to make sure he's on the bus. I've got to walk him to the bus. I've got to walk the dog, all the things, right? The litany of things. And then I was
sure.
like, right? I was like, wait, stop right there. How do you think that you are going to help the other people in your life, all of your patients that are on your schedule? How do you think you're going to help your son this morning if you don't first take care of yourself? And so I stopped myself right there and I was like, everything else is going to be fine. I actually need to go exercise. At my age, with all of the things that I manage, I realized not that long ago that my physical health was extremely important and it had to be a priority.
Sure.
And so I got into the habit of working out every morning. And if I don't do that, my body doesn't feel quite the same. Like I'm not able to get on the ground with my pediatric patients. Right. And so I was like, stop right there, hit a speed bump. And I went and worked out. I think I actually did some strength training and it all worked out fine. And I felt better about the day. And so I would say, for the mother out there that is currently struggling, maybe this is not super helpful. You're not going to maybe start like a daily routine of working out, but doing something like taking a step in the direction of actually communicating to yourself that you actually are important too. Because, no disrespect to dads, they have a different role, but moms are like a very important part of, I think of us as like being the legs of a table. We're all four legs. And, you know,
You
you've seen
I
some
love
really
it.
like strong oak tables, and then there's like the flimsy thing from IKEA that folds into like four pieces, right? And so like choose what kind of a table you are going to hold up, right? And I'm a solo parent. I don't have a co-parent, and I also run a business where I am the only physician. And so I am the only breadwinner and the only revenue generator really in my office. And so there's a lot on my shoulders. And so I actually need to be physically and emotionally healthy to be the strong legs of the table versus like if I don't take care of myself, then, I'm like the flimsy IKEA table that folds into four. So that would be my biggest piece of
Sure.
advice is if it hasn't happened yet, if you're a parent, undoubtedly you've had some sort of a challenge, something. Even if it was like going to work after having a baby and making that transition when they're like 3 or 4 months old, that's a whole other challenge. But if it hasn't happened yet, it's going to happen. And what you want to do is start taking steps now to really kind of buffer and help yourself kind of realize that investing in yourself first thing in the morning, it could be also, I do pray, I do meditate, I do review my goals because, I mean, you own a business too. How many times do you wake up and there's like fires that need to be put out all of a sudden?
Always.
And like this morning, worse than usual, right? Like I was being asked to put out fires and I was like, nope, we are going to do yoga and we are going to walk the dog. And if there was really an imminent fire, then I put it out. But, there's some things that really aren't fires that can wait till I get back to the house or to the office. So, and then
Yeah.
I'm here.
Yes.
Um,
Thank you for being
so
here.
yeah.
So guys, you heard her. Don't I know she's kind of downplaying it, but she is pretty a phenomenal mom, boss lady, person. If you get to know her, you will love her. She is just so lovable. I had the pleasure of being
in her presence at the vision retreat. Probably a few weeks ago it was, I think,
Yeah, in
right,
Myrtle
right?
Beach.
But,
Yeah.
Dr. Palmer is awesome. So, I take to heart everything that she's saying about, making time for yourself. She's doing it, and she's doing it at a level that, we all aspire to. So I definitely appreciate that
Yeah.
advice. I'm a busy mom myself, so
Yeah.
you're speaking my
I
language.
I know, I know. And it's such a I think it's such an important role that we take on. I talk to parents about this. I'm like, I really wish there was a lot more support for parents because if you think about what we're doing is we're actually raising America's future
Exactly.
and footing the bill. We're footing the bill for it, right? Like all the money that we put into childcare, all of the resources and time. And yes, it was volitional. Like, this is what I want to pour into. Like, my son is part of the legacy that I will leave behind. But at the same time, like, it's also something that could really help, our community, our society, our country.
And he
Um,
absolutely will. Yeah.
Yeah. I would say like my second thing for moms out there that I think is really helpful when you're feeling overwhelmed. So like the first part of it is self-care. And as I say this, I'm like, oh, I think this is like the same thing we talk about with teenagers. The second piece is connection, is to
Mm.
find a friend. It doesn't have to be your best friend forever and ever, and you might have friends that you've forgotten about. This happens a lot. We sometimes we're, paced a little differently than our friends. They've had babies and now we're having a baby, or we had a baby and now they're having babies.
Different
You know,
phases of life.
right?
Yep.
Different phases of life where sometimes we get disconnected because we just kind of get very like focused, and rightly so, on raising a family. If you have friends that are near you, even friends that you could reach out to and call, start being intentional about building up friendships. And I would say, especially if there's a stay-at-home mom in your neighborhood, target her. She needs the connection of somebody who maybe isn't a stay-at-home mom.
Yeah.
And each of us have something that we offer and we can help our friends with. And I've had some really great friendships come out of women in my neighborhood who, like, we became besties
Yeah.
and we've been able to help each other in lots of different ways.
Yeah.
I'm a working mom, but we lived across the street from a family that they had a child the same age as my son, and we are still in contact even though they live overseas. And when we see each other, it's like time hasn't passed.
Yeah. Yeah.
But there are ways that you can help each other. And if your child is sick and you're a solo parent and you have a friend who's a stay-at-home mom, like that's incredible backup.
Yep. 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 Yeah.
So that would be my second piece of
I
advice,
like that
is
one.
to stay connected. And as a busy entrepreneur and physician, like, I have to be intentional about staying connected with
Absolutely.
people around me. So tomorrow I'm going to go have bubble tea with a friend of mine who is also a pediatrician in the area who just started her
Nice.
practice so that we can stay connected.
Yeah.
So it turns out, humans are very social beings. And
We
if
are.
you don't, yeah, and if you don't have somebody that you can call up and say, hey, let's go to brunch together, that might be on your list of things to start in 2026.
I know. What do you recommend? Do you recommend like joining Facebook groups? I know some communities they have like
Hmm.
walking moms groups or, things
Yeah.
like that. What do you
I think the biggest thing is like starting with an intention.
Okay.
Right? So I
Whatever works
actually
for you.
yeah, so I went to a conference last year, and one of the women that was presenting, the whole thing was very inspiring. If you have a chance to go to a conference that's in your specialty that will help you up level personally and in your business, I always say go. I mean, we have a mutual business coach, Dr. Una, and she always says, like, try to get in bigger rooms where people are thinking bigger than you. And it
Yeah.
was funny because I went because I thought it would be like a leadership conference, which it was. But here is this woman, she's like a CEO, and she goes, every woman needs a best friend. And
Oh,
it does not have to be your partner, spouse, or husband. She says, my best friend and I, like, we're both CEOs, and we live within close proximity of each other. And when something goes down, right? She goes, we just call each other and be like, matcha latte, matcha latte. And then, like, and then one of them grabs the lattes and comes over,
I
and
love
they
it.
sit and they just chat.
Yeah.
And I was like, it doesn't matter what level you're at in your life. whether you are, you're a stay-at-home mom, you're a single mom, you're a mom that runs a business and runs a family, CEO of a, billion-dollar company,
Yeah.
the human connection is so important. We learn from each other and we hold each other up. So so I set that as kind of my intention, and it hasn't happened yet, but what it's done is it's made me a lot more intentional about the friendships that I have. And my sights are kind of looking for, the perfect person. And it's not like I'm trying to make it happen. It's just that when the opportunity comes up, it will happen. And I put little feelers out, and people sometimes pick up on them and sometimes they don't. I reconnected with another mom. Our children went to school together 3 years ago. For about 5 years they were in school together, and then we haven't seen each other in like over a year. And when I reached out, she was of the same mind. She goes, "Now's as good a time as ever. You want to meet for brunch tomorrow?" I was like, "Great. Yes." So even if it doesn't happen, it's the fact that my brain has this intention that I'm looking for the solution. But
Yeah.
yeah, I think, a lot of people find each other on Facebook groups. I think that if there's a group that if there's when we have a routine in our lives, that's typically where we run into people that, friendship starts to happen. So, if there's like a local moms group of, moms of toddlers that gets together, if there's story time at the library, that can be really helpful. I also found like once my son was in school, it's like when you go to drop off and pick up your child, you're chatting with other parents. That can be a really great opportunity to start making some friends. And you start making some friends and like doing play dates for your kids. And then you start to figure out, oh, these parents and I are kind of aligned and these parents and I are not aligned. And you can get feelers that way. And then also like, their after school activities and things like that. I find that in person is probably the easiest way to really quickly get a rundown on like, is this somebody that, I could develop a friendship with? Yeah. So
Yeah. It's harder as adults to make friends, new friends.
yes,
And you mentioned our mutual coach, Dr. Una. She always says, talk to
talk to
strangers, go
strangers.
out there and talk to strangers because you
Yes.
never know. But I wanted to tell you, so my kids, especially my daughter, because I've made a lot of mom friends through my kids.
Yes.
My daughter, she's in the 2nd grade now, but she did this in 1st grade last year and this year. But she would get her friend, who she wants to have a play date with, to get the cell phone number from their mom. She
Hmm.
would get home and tell me, "Mommy, you need to call this person's
Yes.
or text this person's mom because we wanna have a play date such and such."
Uh-huh.
And, I've done it probably twice, 2 or 3 times, and we're friends, We have had
Gosh. Oh,
and what I've found is just like we are busy and we realize that we need that connection, the other moms realize it too,
yeah.
and they love getting together and getting the kids together, especially when they're
Hmm.
besties and they always go home and talk about this one and this one. And it's like, oh, I want to meet this kid that has you so excited. So that has happened like 2 or 3 times with my
That's
daughter. And I'm
so
like,
good.
because I'm a natural introvert. Like, I can just do me at home all the time, all day, but they're pulling me out.
You know what though? What you're saying is that being a mom is helping develop you, right? Like they're teaching you somehow
They are.
and encouraging you to grow
I
and you're
know.
open to it. So it's so
I know.
good. I know as you're talking, I'm like, oh, I need to call this other mom back and we need to go have brunch again. We had such a good time. Like we hadn't seen each other in a while and there we were like chatting for like 3 hours. And I was like,
Yeah.
thank goodness it's brunch. We didn't close the place down.
Yeah.
They're just getting started for the day. But yeah, our children do. Like our children are our greatest teachers.
They are.
I sometimes will see, parents, and sometimes it's me, like just feeling extremely guilty about something I did or I didn't do. And I think that's just part of the process,
Yeah.
of being a parent is you're not going to always get it right. And I think like not beating yourself up for it too long is important. And I just was thinking, like, this time of year, I will never forget this, but like, I don't know, I haven't had too many mom fails, but like one of my mom fails was last year. I just was thinking, oh man, there's so many jack-o'-lanterns around, there's so many pumpkins, and I kept forgetting to buy pumpkins. And usually we go to a pumpkin patch and it just didn't happen. During the month of October, we do we do flu clinic on Saturdays. And so I was busy giving a lot of flu vaccines and I think I was shorthanded. And so completely forgot about getting jack-o'-lanterns. And then the day before Halloween, I was like, well, I'm just going to go to Safeway and pick up a pumpkin. And there were none. There were no pumpkins. I went to 3 places, no pumpkins. So then I went to like a specialty grocery and bought squash. So instead of, and then I was like, this could be a moment of brilliance because
Exactly.
instead of jack-o'-lanterns that we carved, we just had like a gathering of squash. And then when Halloween was over, we just ate them. It was perfect. It was perfect.
You
And then,
did it. It's not a
yeah,
big meal, Dr. Paul.
no, it was actually a nutritional win. It was great. But this year I did buy 4 pumpkins.
Okay.
I
I'm
bought them
sure
when
he
I saw them.
appreciated the effort though,
Yeah.
you know.
Well, I live in Portland and we have all these like pumpkin farms around here. And like
Sure.
going to a pumpkin farm is a big deal because they have like all these
Really.
activities and stuff and
Sure.
all these very like bougie pumpkins. There's like Cinderella pumpkins, ghost pumpkins. There's like yellow bumpy pumpkins. I don't know what they're called. So like people get people become pumpkin connoisseurs here. And so like just a regular old orange jack-o'-lantern won't do. Like you have to have a beautiful
Got
assortment.
it. Got
And
it.
because of that, I didn't get a pumpkin last year. And then this year I have pumpkins. And
You
maybe
still
we'll
have that.
carve them. Yeah. But I mean, life is just full of like mom fails. And then like, you want to write these down because they're pretty funny later
Yes,
on.
they are.
Like, the day that I sent my son, so he does not like to eat sandwiches ever. And so it gets cold here. And so I will take a double walled thermos that I got on Amazon. I fill it with hot water to warm it up. Then I
Yes.
take the leftovers. Like this morning, it was like pasta with pesto and chicken sausages. And I warm that up. And then I put it into the double walled thermos. And I've only done this once because it was hilarious when I did it. We were just in such a hurry to get out of the house. That day he comes home and he's kind of a jokester too. And he goes, "Hey mom, thanks for lunch today." I was like, "Oh, you're welcome." And he goes, "It was just water." Best of intentions. I wanted to send him home with
Love,
a homemade lunch and I sent him with, hot water in a thermos bottle. So we
love it.
just,
I
we
love
just
it.
laugh.
We laugh.
We
It
laugh.
happens. I
Yeah.
remember during COVID, so I was in residency, and my son, he had just lost his first tooth.
Gosh.
Yeah, and the tooth fairy forgot to come.
Yes. My goodness.
What?
Yeah.
That's what I said. The tooth fairy had COVID.
That's hilarious.
So the next day he got it. But, that's
Oh my goodness. That was a good one. You know what? I've done that before too. And I bet you, like the moms listening around, probably everybody has had that happen or knows somebody who did. I did the same thing, but I wasn't so clever. I completely forgot. And then my son would be like, "Mom, the tooth fairy didn't come to pick this up." I was like, "We have a lazy one. We have a lazy tooth fairy." So
Yes. Yes.
I was like, "Just stop losing teeth. Then she'll be able to catch up."
We've all been there. We've all been
My goodness. Yeah. And I think the thing is like to forgive yourself quickly
there.
and just realize like, stuff happens.
Yes,
And
it does. It does.
if they remember, it makes it for a really funny
Yes.
story.
Because I'm sure he'll think
That's
about that
cute.
later. Like, there's
That's
no
cute.
tooth fairy.
Yeah, she had COVID.
But yeah.
My goodness.
Oh my gosh, Dr. Palmer, this was awesome. Thank you,
You're welcome.
thank
Well,
you for go
yeah,
ahead.
I was gonna say, I hope it. I think it. If I knew this when I was in my 30s, I probably would have had a much more intentional life. And I
Yeah,
think for moms out there that feel like life is speeding by really quickly, because this was me. I would say 4 years ago, I just thought, is this all there is? Like, why is he growing up so fast? Why can't I remember, what we did for his last birthday? How is it that like his next birthday is just like it's like here? And I haven't even planned for it. It may be that it's not that life is going by too quickly. It's that maybe the intentionality in life has been lost by just getting busy. And, there's different ways to kind of slow down. But I would say, the first thing to do is to slow down for yourself and to take a minute.
yeah.
Just even start with a minute. One of my friends is a movement coach, Dr. Sarah Ionescu. I actually interviewed her I have a digital course called the Joy Reset
Okay.
or the Joy Reset Summit. And I interviewed a lot of like physician coaches because I was going through a really hard time in my life not too long ago, about 7 months ago. And I created this digital summit because I wanted to help moms get through the hard times, not realizing that I was in a hard time. And the really cool thing is when I was done doing all the interviews and everything and put together the course, my hard time really kind of came to like just kind of came to the surface. And I found that I was using all the strategies that I had learned from the physician coaches that I had interviewed in the Joy Reset Summit. But Dr. Sarah Ionescu is one of them. She's a mother of 5.
Yeah.
She's also a family practitioner, and she's the one that taught me just a minute of movement a day.
Yeah.
The way that we like approach our days when we've just even taken a minute. I mean, imagine a mother of 5, and she was coaching even when she had a newborn.
Yeah.
And it's the frame of mind that we approach ourselves and our lives with that make all the difference. And that 1 minute is like communicating to yourself that you matter, that your energy, that your intention, that your love that you bring to your job every day as a parent, like you matter first. And
Right.
that's how you can give to your family. And that's, I think the women that we see around us that are mothers that we kind of deem successful, I think they've channeled that. They've figured out how to do that, right? It's like, first I take care of me, and I take care of everybody else.
You can't pour from an empty cup.
Exactly.
I know you mentioned your course. Can you tell us more? Where can, busy moms or moms going through something? And I'm sorry
Yes.
that, you went through that, but I'm glad to hear that, you had the tools you
Yes.
needed to get through it. So if there's
Yeah.
listening who's like you and she needs those tools, where can she find that course?
Yes. So I'm on Instagram a lot. A lot of my families that I take care of are on Instagram as well. It's Kirin at Kirin Palmer, MD. So KIRINPALMER. MD, and you'll see my happy, joyful face. And in my link tree, there's a link to the Joy Reset Summit, and it comes with a book and it's asynchronous. So I envisioned somebody that was like sitting in car line like me, or driving to work, or doing the gardening, or even washing dishes, just listening and kind of listening to the coaching. And these are women that, a lot of these women are women that Dr. Cindy, and they are so full of wisdom. And
Yes.
I think, the advantage of having access to like amazing coaching just accelerates and propels you forward. I mean, you could Google anything, right? But it might take a whole week or 3 months to get this kind of wisdom that's just kind of been sort of consolidated and kind of put into a nutshell and just very easy to access. So thank you so much for having me on your show. It's been so wonderful.
Absolutely. It was our pleasure. It's all ours.
Yeah,
I don't know if you're feeling it, but I'm feeling it. The
I am.
warmth, the kindness, the love from Dr.
Hmm.
Palmer. Like I said, she is an amazing individual. I am gonna go check out that course
Thank you,
because
Dr. Cindy.
life hits all of us at
Oh,
certain
yeah.
and we can all benefit from it as busy moms.
Yeah.
So definitely, definitely, definitely check that out. Dr. Palmer, like I said, it was truly our honor and our pleasure to
Thank
have
you so much, Dr. Cindy. I
you.
think this is an amazing way to start the day. I'm going to go head out and start seeing my patients and
Yes.
bring just this beautiful, like,
Dr. Palmer love. Yes,
joyful intention to my work today. I am so grateful to you, Dr. Cindy.
of course. Same here. All
Have a
right,
great
guys.
day.
Until next time, take care.
All right. Take care. Bye.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.